Camilla Kittrell of San Antonio. She has addressed the same information gap from a more clinical perspective. She tackled the problem in introducing an online survey that is completed by the patients 1 week before their clinic's visits. And based on a commercially available online tool called SurveyMonkey, a web survey was developed that included questions regarding the medical status, medications, several symptoms, medical equipment, and also social concerns. And in this slide you see a typical page of this online rating from the patient's perspective. And 78 patients completed this online survey, and the vast majority of patients perceived the quality of care and also the clinic flow as improved, and also very important that the team members felt more prepared to the questions of the patients and more prepared for appropriate interventions. And the time spent, and that is very important for anybody who knows what practical care means, the time spent by the team members on the telephone was cut more than 50%. In summary, the introduction of information technology led to an improvement of resource efficiency, of data quality, and the empowerment of patients. And these studies contribute to the notion that, from my point of view, the actual revolution in medicine is the empowerment of the patients to become full collaborators in the healthcare team in order to manage their own health. At this symposium, we have learned more about large-scale trials, and I'm just selecting and just talking about 2 trials, about ceftriaxone and the new drug of Knop Neurosciences. The ceftriaxone trial is in 3 stages. Stage 1 is on pharmacokinetics, another stage is safety and tolerability. These 2 stages have been completed yet. Now we are at stage 3, that is a full-scale efficacy trial of 4 grams ceftriaxone a day, participating of 600 patients at 62 centers and with a duration of 52 weeks. There's another trial featuring the new drug of Knop Neurosciences called KNS 704, and for this drug a placebo-controlled phase 2 trial has already completed, involving 102 subjects at 20 ALS centers in the United States with 3 doses lasting 12 weeks, and the result is that the drug is safe and well tolerated, and possibly there may be a dose-related change in the slope of decline for the ALS functional rating scale, although this study was not powered enough to make a final conclusion on that. Anyway, these data are encouraging for the phase 2 trial that will begin in the next year. In the remaining minutes, I'm going to highlight 2 talks on the phenotypes and diagnostics section. The first paper is of Bökestein and co-workers from the Netherlands, and studying the clinical implication of the new EMG criteria for ALS as proposed by the Abai Commission. There are 2 major changes proposed by this commission. The first is that the EMG evidence of lower motor neuron involvement is equivalent to the clinical evidence, and the second novel criteria is that fasciculations in the EMG are equivalent to fibrillation potentials in positive sharp waves. And in a study of more than 200 patients, the authors demonstrated an improved sensitivity of the new ALS diagnosis criteria by 16%. And this may lead to earlier diagnosis, more individualized consulting, and timely management. The second observation I want to highlight is the work of Julie Foucan, and she studied a great number of patient and matched controls using a quite impressive, extensive neuropsychological battery at 3 times over 18 months, and unexpectedly 19% of all ALS patients fulfilled the diagnostic criteria of frontotemporal lobe degeneration. And of those who were tested normal, and that is very important, and the first assessment, only 7% had evidence of cognitive impairment in the further course of the disease. The authors conclude that the prevalence of cognitive changes in ALS is much higher than previously recognized. Another aspect is that this piece of information may help us in the complex consulting of patients and their families. Ladies and gentlemen, my time slot is somehow filled, and I regret that only for time reasons I was unable to highlight all the presentations I would like to, and it's a shame not to mention the presentation of Dr. Oliver and co-workers on palliative pharmacotherapy. It's a shame not to mention or to touch only the presentation of Dr. Neary about frontotemporal dementia, and there was also a wonderful talk by Martin Feck from Munich about meaning in life. Also in this year we were privileged by a high number of high quality contributions that immediately have an impact to clinical management. And out of the many contributions, I have observed some symposium trends I would like to mention here, which I'm very positive about. There is more evidence for symptomatic treatment and care, that there was an improvement in palliative care, a progress in trial design and also trial management, and very important, the integration of information technology, most of all to empower the patients and their families. Ladies and gentlemen, I was born in Berlin and I'm living and working in this city, and for me it's a high life enough you have you all together in my hometown, and I hope that you appreciated your stay in the city and will come soon to this place with good vibrations. And a video of this talk will be available soon in English and in German on our webpage alshome.de. Thank you very much.